Ever since we met, he's complained about back pain and how he hasn't gotten treatment for it. He's like, I've had it since I've been very young. Everyone says, you're young, you're thin, you're skinny, so you shouldn't have any back pain.
Oh, shoot! I would tell my mom and she would take me, then the doctor wouldn't do nothing about it.
They wouldn't do anything?
They're like, no, I don't know what you're talking about. You're too young, you're not overweight.
Yeah. What do you notice is a big difference?
That's mine right there?
Yeah.
Oh man, it's closed. Oh!
That was a lot.
Oh my God.
When I see him with his back pain, I can see him like guarding himself to even play with them. So I'm happy to get it taken care of so he can actively play with them.
I think we forget about ourselves and you forget about how much pain you're in, and that's why you continue to move forward because you're just trying to provide.
Yeah.
Right.
I just figured I was gonna die with back pain.
Hey.
I'm gonna die with back pain.
Let's not do that. Happy birthday.
Thank you.
My present to you.
I've seen videos like these type of yours, but like I've seen these people crack. I'm like, it can't be true, bro. It is true, man. Shoot.
Tell me about it more. Tell me, obviously it's bad, so I know Bridget, you decided to bring him here. All right, he didn't see any of the videos, so that's great. Maybe let's start with you. What made you want to bring him in to come see us?
Ever since we've met, he's complained about back pain and how he hasn't gotten treatment for it. He's like, I've had it since I've been very young. Everyone says, you're young, you're thin, you're skinny, so you shouldn't have any back pain. And so when I saw your videos and you had a similar story, I knew this is exactly why he needed to come.
Yeah, I think that's perfect. What I find very frustrating is that I remember getting it all the time. Like, you're young, you're not overweight, like you shouldn't have any pain. I'm like, okay, but I have pain. So just because you're telling me I shouldn't doesn't mean, I agree with you, I shouldn't, but I have it. And I think the worst thing about it is that the thing is when your body gives you pain, that's like a clue. It's an indicator saying, hey, something's going on with me there. I need you to fix me or else it's just going to continue to get worse, right? How old did you just turn?
I just turned 50.
Jeez, okay. Well, whatever genes you got, man. So as you get later on in life and as you're starting to become older, your body starts to degrade even faster. And with the head nods, there's young.
Your 40s.
Yeah, your 40s.
It just went downhill.
Yeah. So
it looks okay, but like inside is like probably like really bad.
Yeah, to be honest with you, right, there is definitely something going on with you. We don't want to let it go untreated any longer, and I'll tell you why as we start to go through this. So tell me, how bad is the back pain for you now?
It gets bad when I do really strenuous, like let's say concrete or like a side job that I need to do like at my home, or someone asks me to do something like that I usually don't do. I really feel it, and it like sometimes it gets so bad that I can't even get up sometimes. Like it's terrible. Like I don't know if it's the sciatic nerve or I don't know what it is, but like it shoots all the way down to my leg, all the way up to my neck.
So it goes up and down.
Yeah.
That's horrible.
Yeah.
So you have multiple things in your body that are straining you. Because when you look at a person's body, right, you have basically halves. Yeah. So this half, a lot of that lumbar controls down through here, up and through here. You have this. So if this lower part is going down here and here, you're compromising two systems already.
Right.
So it gets bad. Scale of like 0 to 10 when it's at its worst. What would you rate it?
Oh God, I can't get up. 10, yeah.
Currently, what's it at?
Oh, right now like 2, 3.
Okay.
It's always there. It's always like but like I just learned to live with it.
So for the past, since you were 11 years old,
that's the first time I ever I felt like, oh shoot, what the heck is that? Like,
did you fall? Did you do anything crazy?
I told my wife maybe I picked something up wrong, but I don't remember what I picked up. Maybe. And ever since then, it would come and go. Like, obviously, like how you said, as I got older, it got worse.
Honestly, like just a side note, this is exactly why I tell people like bring your kids in, because you just don't know. Like they play, they fall, they do all. Like
and I would tell my mom.
Yeah.
I would tell my mom, and she would take me. Then the doctor wouldn't do nothing about it.
They wouldn't do anything.
They're like, no, I don't know what you're talking about. You're too young. You're not overweight.
Yeah.
Like, I guess what they think it caused back pain. Like.
Yeah, that's wrong. I'm sorry.
Yeah.
I'm sorry you went through that. I think everything that you've been going through is valid. I think even from 11 years old is valid.
Yeah.
And I think now that you're 50, you know, I think it's even more. I mean, 40 years, right? Basically,
40
essentially,
years,
40
yeah.
years you've been dealing with this back pain.
Yep.
I got to ask you, like, are you scared about it? Are you worried about it?
No, like I said, I've learned to live with it.
Yeah.
Yeah, it's just part of my life. Yeah.
Right. So we want to unlearn that.
Yeah.
Right. We definitely need to unlearn that, because I think in the next 5-10 years, the way that your body is degraded since your 40s to your 50s, right? I mean, think about from your 50s to your 60s.
I know. Yeah.
And that's where we need it stopped right now.
Okay.
I mean, obviously she knows it's bad and she's like, I need you around. So I want you to notice this lower part here. Do you see these spaces in here?
Right.
Right? That space is where this disc is. That disc is a shock absorber. It needs to be in there. Really mainly because to protect this line that comes out. This line is your spinal cord accentuated, right?
Okay.
So this is the spinal cord. It goes down into that spine and comes out. So when you have pain, a lot of times it means that this cord, or that there's a lot of pressure and it's not moving in these areas. So the thing is, when it's nice and tall, you can see that that room is good. But if that space closes, what happens to that nerve?
Pinch.
It pinches, okay? And then what kind of pain do you think you have?
Yeah.
Sciatica.
Back, yeah.
Sciatica, right? So that's why that's important. So when we look at your back here, and then we look at this normal, what do you notice is a big difference?
That's mine right there?
Yeah.
Oh man, it's closed.
It's close. It's getting close. Almost
the
completely.
heck?
That's not good. So where that nerve is supposed to come out of, do you see that hole? It's really closed, right? So this is never going to look like this, but this can stop and become a little bit better the way that it needs to. This is a product of you having lower back pain for the past 4 years. It's good that you're skinny. Hey, that's great, right? But the fact, like, this probably would have been worse if you were fat. But the thing is, that doesn't look good whatsoever in there. So when I see that, what that's told me is that there's no motion that's involved in there, and when there's no motion that's been involved in there, that means that you're going to have pain in there. So my objective today is to decompress that entire lower back, but also allow more movement into that spine so that you can start to feel better without drugs or medication. The most important part is, from this point on, is that you stop the degeneration and you stop your body from becoming worse, because if you let it go, it completely collapses and then you're having no movement whatsoever. So the pain becomes permanent, everything becomes permanent, and you obviously don't want that.
Yeah.
Right. Another thing that's also affecting that lower back is the fact that your neck curve is not good. So ideally, when we look at somebody's neck, it should look something like this here. Okay. So when you look at this curve and you look at this
It's
curve,
going the opposite.
it's going the opposite way.
Yeah.
So ideally, it's supposed to be at 43, and then when we look at yours, you are at a negative 2.4, going the opposite way. How does that impact your lower back? Well, if this part is moving forward, I want you to notice my back. So the more my head goes forward, what happens to the back? You start to lean, right?
Yeah.
If you ever fish and cast that line out, in order to pull that fish back, what do you have to do? You pull from the
back,
base,
yeah.
right? So you're basically pulling, and this is pushing, like this is pushing out, this is pulling back.
Right.
And so you always have this tension into here, not only because of that lower back, but because of the neck
Right.
as well too. So it's probably also a reason why it shoots up into the lower back. We know why it shoots down your leg, but this is probably why it's shooting up as well too. I think you'll get a lot of relief even after today. I don't think getting you out of pain is the hardest thing. I think it's keeping you out of pain. And the reason why is because your body's developed this pattern. It's like you in mentally, if you're gonna develop this pattern, you're like, oh, I know how to overcome it, right? That's a pattern. And you know how to like not feel it. So we want you to feel again and feel normal. Okay, all right. I'm gonna do a few tests on your neck and then your lower back too. So turn your head to the right for me. Okay. Stop there. That's about as good as you can go, right? So nose is about like 50-ish degrees. Ideally, it should be closer than 90, like your nose should be over here, seeing your lovely wife. This way. Look to the left. This is much better, yeah? So you're like 70 here, should be 90 this way. Look straight. Let's have you look up to the ceiling now for me too. Is there any pain when you do that?
No.
No. And then look down. Any pain when you do that?
No.
No. Okay. Stand up now for me as well. And then try and touch your toes for me.
Oh, heck.
Yeah, so that lower back is just flat as a board, like it ain't moving. Come back up. Does that hurt your back when you do that?
it actually feels good. It's like kind of stretch it a little.
Yeah, so it feels good because it's opening that disc and it's opening that space where that hole is, where the nerve comes out. So it feels good that way, right? Let's have you go face down. Does it hurt to walk?
No.
No, okay, yeah, go face down for me. Here, all right. Now, keep the left leg straight and lift it up as high as you can for me too. Yeah, it's not moving. Does that hurt?
Yeah.
Yeah, go back down. Do the right side. A little bit easier that side, yeah?
Yeah.
Go back down. Okay. I forgot to ask you, what do you do for work?
I own a trucking company.
Okay. You still drive?
Yes.
You do? Okay.
Yeah.
How often are you driving?
Every day, like Monday through Friday.
Wow. You're sitting down a lot?
Yeah.
Okay. That's probably why you have a lot of the back pain too all the time. You're sitting down and you're also taking all the forces of the road all the time.
Yeah.
And your body hates being in that seated position because in this lower back, so most people, like all your weight normally is supposed to be back here when you're standing up.
Yeah.
Like when you're standing, like it can distribute. When you sit down, the forces in this lower back becomes 3 to 4 times as much because the rest of the body doesn't take any of that weight, right? I'm gonna do this here. It's okay. See how like it's stuck right there? So I'll show you something. So when I do this side, it's not that great either, but this side has a little bit more give this way. And then when I do this side, there's nothing. Can you feel that?
Yeah.
Yeah. All right. So what I'm gonna do here first is I'm gonna push in through this. I'm also gonna feel into the rest of this back too. So we're pushing up on this sacrum right here. So it's also about like analyzing what we're feeling. We always want to see how this is. So when I pull this, you see how like tight that is? So when I do this, it doesn't move. So I'm gonna pull this way, all right? Loosen this leg a little bit more for me.
Oh,
Yeah.
God, shit. Oh, man.
Give you a minute.
Oh, shoot.
Felt it open up a little bit?
Yeah, damn.
So just gonna go down like this. And I'm gonna push down right through here to open this spot. You can feel that, I know it.
Mm-hmm.
Yeah. We gotta make sure that the look of you matches the body. Or the opposite way, right? Whatever. Good. Left leg all the way up again. Nice. That was smooth. And the right side. Yeah, good. Stand up for me.
Yeah, I really felt that.
Yeah, right?
Yeah.
Let's have you walk around a little bit first. Actually, let's walk through the hall. Good. Now from there, stop there, face that way, walk backwards for me. Good. Good. And stop. And turn around and face me this way. All right. How you feeling?
Yeah, I can still feel like right here, but it's like I can feel like it's releasing something, man.
Yeah, it's almost like it's like we're taking air out of the balloon, right?
Yeah.
Good. I want you to sit here again. And then what I should have done this before, I wanted to see, but put your arms like this. And then I want you to slowly turn to the right. Okay. And I want you to slowly turn to the left. Good. Probably should have been harder before, yeah. All right, let that go down. Now what I want you to do is you are going to sit here facing that way. All right. We have like loads basically, right? So this is a big area that you're gonna take a lot of that weight. This is a big area, this is a big area, this is a big area. So with you, this obviously area is one, but when I was feeling it, there's another area that's right here that's a little bit flatter that's also taking a lot of that weight as well too. So we need to open this up a lot more, all right? Hands like this, let me see the other hand, just like that. Beautiful, all right. Relax the shoulders a little bit more. Loosen. Yeah, good. So I want you to lean back there for me. Keep your body curled though. Good. That's great. And then let your body arc backwards. See if you can do it. Go back down, head down. Tough, yeah?
Mm-hmm. Oh my God.
Okay, come back up. Good. Let's go back down, opening my hand. Breathe out. Up.
Oh, shoot. Oh,
That was a lot.
oh my God. Oh, shoot.
That was a big one. I'm sorry, man.
Man, dang.
I had a feeling that was going to be kind of rough. I didn't want to tell you, or else you would have guarded a lot.
Yeah, I would have tensed up.
Yeah.
That's why
I
you
was-
show many videos.
Yeah, that's good.
Yeah.
I don't know if you remember when I was pressing here and I was pressing here.
Yeah.
This was tight up top, but when I pressed into this mid back, this relaxed a lot.
Yeah.
But I knew that this needed some extension to go back to the opposite way. Right?
I couldn't even bend back like that. Like, it was,
It was tough,
yeah.
but that moved a lot.
Yeah, man.
Probably the toughest one we're gonna do.
I'm glad I didn't look at the videos. I wanted to bend back.
Lay on your back now for me. All right. I'm gonna take this one here and then take this one here. It's a lot easier than the last one, I promise. We're just like this. We're gonna roll a little bit this way. So this is that other spot that I was feeling on you. Good. Relax this shoulder here. Good.
Oh,
yep.
shoot.
Good. All right. All right, move.
That was a double crack. Oh, man.
That was good. Awesome. Now let's stand up again. Good. Actually, try and face that way.
I didn't feel any pain leaning back. Dang, that's crazy.
It's weird, right?
Yeah.
Let's have you lay on your side. Face me this to that right side. Yeah. Good. Cool. Let your head go down. Any kids? Anything? Yeah.
Yeah, pretty much 5.
What? That's why you left. I got you. What are the ages?
Oh, I have a 30-year-old, a 27-year-old, and
Oh man.
7 and twins. We have twins.
Oh gosh. How old are the twins?
4.
Wow. Twins. How is that?
Oh, man.
Don't even bring that.
That sounds rough.
Those first 3 months were a blur, for
I
sure.
can't. Did you get any
It
sleep?
really tested our marriage.
100%.
Yeah. It had to. But
And
hey.
so they're so young, and when I see him with his back pain, I can see him like guarding himself to even play with them. So I'm happy to get it
Yeah.
taken care of so he can actively play with them.
I mean, that's huge,
Yeah.
right? Like, I look forward to coming home and seeing my kid and like playing and like lifting him up. And I mean, like when somebody comes in, somebody like yourself and has lower back pain, I'm like, man, it just like everything in my mind, like I just can't ever have that. Like, I don't want that ever again because I know how bad it was. And it's more of like just me being healthy. Like, yeah, I don't care about myself, but it's like, but can I be there for this person? We want to do this, not even just for ourselves, but for the people around us.
Absolutely.
So we're gonna hit this sacrum part right here, right? I'm gonna go pretty easy on you,
All right.
right? I know you haven't seen the videos, but I'm not gonna drop like you've seen in the videos. What do you notice is a big difference?
That's mine right there?
Yeah,
Oh, man, it's closed.
it's close. It's getting close, almost completely. So where that nerve is supposed to come out of, do you see that hole? It's really close, right? So here opens right there. Could roll a little bit with me. That's better. Right here, easy.
Oh, shit. Oh, my God. Oh, man. Oh, my God.
Take your time.
Whoa.
How did that feel?
Well, I'll see you later, but that was pretty rough, man.
Yeah, it was a little rough, yeah.
Oh, man. I've always wanted to do this, so. I think that one was harder than that other. Than the one you said that was going to be the worst one.
Yeah, may have lied to you again.
Can I sit up or?
Yeah, go ahead.
Oh, man.
Yeah.
I could totally feel like the release.
How you feeling, man?
It's good. So good. No, right now I would like just sitting here. I would feel something in it, and I don't know why. I'm not really like feeling the. I'm not feeling the pain right now.
That's so good.
Yeah.
When's the last time you could have said that?
Oh, it's been a while. Yeah, it's crazy.
I think, especially as men that, you're trying to provide for your family. I mean, you got 5 kids. It's tough. And I think we forget about ourselves, and you forget about how much pain you're in. And that's why you continue to move forward, because you're just trying to provide.
Yeah.
Right.
I just figured I was going to die with back pain.
Hey.
I'm going to die with back pain.
Let's not do that. Yesterday, one of my favorite phrases became, I actually feel good. So I always ask people, like, how do you feel? And they're like, oh, I actually feel good. I'm like, you actually feel good? But also, it's like saddening for me, because you thought you were going to live in pain for the rest of your life, right? You don't have to.
Yeah, my wife asked me, what do you want to get out of this? And I said, well, be pain-free for the rest of my life.
Wow, yeah?
Yeah.
Let's turn and face your whole body now that way. So this part in through your neck is kind of stiff. With you, like we were talking about before, your neck moves really far forward comparatively to what it's supposed to look like.
Right.
One of the things that we also see is that you have this tilt, but it goes a little bit to the left and it goes to the right. So we're going to bring this centered. When you think about your body, I want you to think of like a spider web when I'm adjusting you. I'm trying to take off the flies that have been in there and try and make it smooth again.
Okay.
Right? So first thing, right up there. So C4, that's where that bend also starts to happen. So his neck is tight, guarded too, because I think it's from all the stuff that you have to do from the road. There is this part that needs to move. So you're gonna come this way, and we're gonna come bend this way. We're just gonna pull. Oh shoot!
Dude. Oh man. Man, that's good technique. And I should sneak up on you, man. Ooh, man. You don't know what you're doing, man. You break somebody's neck like that. Yeah, man.
Like I said, I knock on wood, make sure. Right?
Man, that's crazy. That's good. Man, it feels good though.
When somebody's body has been through so much trauma and so much stress, the last thing they want is even more trauma.
Right.
You want something to be nice and easy. It's like I hate to use this just because I think it can be distorted, but there's masculine energy, feminine energy, right? Sometimes when the person has used their masculine energy so much, we need a little bit more feminine energy to get adjusted. And it's such a weird concept, but it's so true. Like, we want to be handled with a little bit of care, right? Let's have you lay on your back now, this way. I'm gonna take his head. We're gonna be real easy. Not adjusting hard on it, nothing crazy. But we're first floating that spine so it's nice. Good. Easy. Little extension. He likes extension. Body is good. Beautiful.
Oh man. That's crazy, man. People have to experience this, man. Man. 50 years I've been waiting for this. This is what I expected when I went to these chiropractors, and they never did nothing for me.
Man, just took 50 years to get there, right?
Yeah, my 50th birthday. That's what it took.
Happy birthday.
Thank you.
My present to you.
Oh, man. I've seen videos like these type of yours, but like I've seen these people crack. I'm like, it can't be true, man. But it is true, man. Jeez.
Good. Let's set you up.
Awesome.
1, 2, 3 up. So if you're wondering, Bridget, about the Y strap, ain't no way today. No. Ain't no way. But this is why I listen to my intuition a lot, to make sure, like, hey, you're comfortable, but let's check you out. Look straight. Turn your head to the right. Beautiful, huh?
Yeah.
Left. Yeah. Look straight. Let's have you stand up now for me. And move forward a tad. Let's try and touch your toes again. Nice. How does that feel on your back when you do that?
It's that's like 2 inches lower or more.
Come back up. How does the pain in your back feel?
I didn't feel it as much. It's more like my legs I need to exercise more because my legs are keeping me from bending more. Yeah.
So the reason why it's because like you've been you've been scared to do it, so you've
Right.
stiffened up your legs.
Yeah.
So that you don't injure
Yeah,
yourself.
I feel it right here. That's
Yeah.
why I can't bend all the way down.
And that's okay.
Yeah.
Let's have you sit real quick, and then what I want you to do is do a prayer again, and then twist to the right. Let's see how we do. That's nice. How does that feel?
Good.
Look to the left. How does that feel?
Better. Yeah.
There's a lot more rotation
Yeah.
in that area for sure.
Yeah.
So it was probably harder to go to the left,
Right.
right? Because that sacrum was so far rotated already this way that when you try to turn, it was like stuck.
Right.
So now when we're able to turn to that left side, it's much better. How do you feel, man?
Happy.
Yeah? 50th birthday, right?
Yeah.
Happy birthday, Sergio.
Thank you.
50th, right?
That was
Sorry
awesome.
it took you so long to get some relief, but
Yeah.
today's a new day,
Yeah.
right?
Yep.
And thank you for bringing him in.
Thank you.
Yeah.